adopting those healthy behaviors will give you points and they will give you rewards. And then the last piece, you can also order medication on the platform as well. So it's a really a comprehensive look at the patients and how to deliver care to them very effectively.
This is Blair Durham with Black Wall Street Today, your media hub for all things Black entrepreneurship, politics, news, and events in Hampton Roads and beyond.
And now, here's your host, Blair Durham.
Welcome, welcome, welcome. It's the 117th edition of Black Wall Street Today with Blair Durham, and so excited to share with you all. Without further ado, I'm excited to welcome our first guest. His name is Mohamed Kamara. He is the founder of InovCares. It revolutionizes chronic care management by sustained behavior change through social rewards. Its program rewards employee healthy behaviors with donations and rewards to the causes that motivate them. The journey began after the passing of Mohamed's sister during childbirth due to preeclampsia, which is a preventable hypertensive disorder. InovCares empowers employees with a digital health behavior change platform that combines patented NASA technology and computer vision via the smartphone camera to provide personalized health reports spanning health risk, metabolic health, and body composition to inspire mindful health and fitness decisions. InovCare provides a community for collaboration with coworkers, friends, and family in order to gamify health goals and be rewarded for meeting those goals. It also provides 24/7, 365 access to culturally relevant health professionals that make it that much easier to inspire people with chronic conditions to stay healthier. Welcome to the show, Mohamed. How are you?
Thanks for having me on, Blair. I'm well. I'm excited to be on here.
Excited to have you. You are doing such relevant work, such big work in the space of healthcare innovation. So thank you for your contributions to the field, for sure.
Sure. It's been one of a unique journey. I just shared that my sister passed during childbearing. It was probably the only reason why I came into this space. Prior to that, I was in healthcare finance.
Wow.
When hospitals are looking to buy clinics out, I come in and do the evaluation work for them. So when my sister passed, my aunt passed as well in Columbus, Ohio. So there were two tragic deaths in my family that led me to really try to solve this maternal mortality rate for Black women and Latinx women.
Huge. Yeah, I've seen a number of platforms being developed to address that, and even some statewide and some federal initiatives as well, looking at that, those mortality rates. Very sad, but again, I appreciate you doing the due diligence. So I assume this means you're not a technical founder. Is that right?
So yes. So I came from more of a healthcare, health finance, and also a little bit of health IT, right, on the due diligence. So I had a minor in computer programming, but it wasn't so heavy because I didn't utilize it when I came out. So at first, my background will help me be more of an effective product manager.
Sure.
Right? This is for non-technical founders that are out there. If you're not going to code, or if you can't code at all, be a really efficient product manager. You have to fill the gap between you and writing the workflow, writing the requirements for the developers to execute, and then be able to be a very good product manager in terms of marketing support as well. So there are relevant skills that's still needed as a non-technical founder to be an effective leader in terms of getting your product from an idea to a vision, right, to making it real and out there to the public to use.
Yeah, for sure. So I'll kind of come back to that. I want you to just really talk through the product and how are you connecting with the end user and all of those things.
Yeah, sure.
Share screen and pull up your website while you're doing that as well. I'm so excited.
Awesome. Yeah. So when this journey happened, I went to DC. I actually had a chance to travel abroad as first. So I went to Dominican Republic, Costa Rica, and as well as Cuba. And I noticed that I went out to Cuba, Costa Rica, actually to Dominican Republic to actually be able to, I was out there providing care to women that were affected by the Zika virus, but then we then took that journey and noticed that there's a gap in care delivery in international as well. So Caribbean countries and as well as African countries. We fast forward, I then went to DC and launched the platform in 3 clinics in DC. So how the platform works, it's one telehealth solution and then as well a health wellness solution. There's two apps. There's a provider app and then there's a patient app on iOS and Android. And then there's a web version as well. So part of the technology is for patients, for users like ourselves, we can be able to connect to doctors virtually via video and in-app messaging. It's HIPAA compliant. So we can search Black doctors and other culturally relevant doctors. Even if they're non-white doctors, if they're non-Black doctors, they have that cultural competence, which is very important in delivering culturally competent care. Because that's usually the gap in the assumption that Black women, and as well as sometimes men as well, that they have more high tolerance for pain. For pain, which is, we need to remove that, right? We need to remove that stigma, because then these assumptions when people are in the process of delivering, they get to experience deny and delay. That, hey, your pain is now real, go home. And between that gap that happens, you being dismissal of that mom of that person that's suffering pain, that usually leads to death. That's what happened to my sister, right? So this is where hypertension is a big thing. So the product itself is one more connecting to docs, but connecting to wellness coaches, so you can connect to a health coach, a personal trainer, nutritionist, a mental health specialist. So it's literally a comprehensive care. And then you can do a virtual assessment, which is a part that's patented by NASA. You can take a 10-second video of yourself and it's paid back 5 clinical reports about the patient's health score, their corrected BMI, and the health risk they may be predisposed to. So if they're predisposed to like type 2 diabetes, hypertension, it shows those scores and then how to improve that. And then we also put you like in a community that's called a health tribe, but you can connect to with your friends and family, add your friends. You can go on walks, hikes. When you do those activities, we count your steps and then we reward you for actually adopting those healthy behaviors. We give you points and then we give you rewards. And then the last piece, you can also order medication on the platform as well. So it's really a comprehensive look at the patients and how to deliver care to them very effectively. Without telling them to log into all these multiple platforms. And then the provider side, they do the video consult. They can do e-prescribe as well on the provider side, meaning like doctors, wellness coaches, etc.
Huge. Talk about adoption a little bit. How is the public receiving the platform?
So when we launched, we launched in 3 clinics, in an addiction medicine clinic, a pediatric clinic, and then a wellness, and then a women's health clinic. So we utilize the network of existing providers, right, that already have patients. So we saw 3,000 patients on the platform.
Wow.
And so instead of us spending so much money on marketing, we empower providers to be able to see their patients on the platform, which reduces that marketing cost, right? Instead of going the other way, doing a lot of those Facebook ads and other social media ads, which may not hit right? So we sell to providers. So our first customer base is providers and then their patients, intuitively. So providers pay us between $50 to $150 to utilize the platform. And then on the patient side, the patient can utilize it. They can utilize certain function of the platform for free, or they can pay $10 for utilize all of the functionality of the platform. So our first customer base is really selling to providers. So we tap into that network first because they already have existing patients instead of disrupting the patients and the provider relationship.
Amazing. And genius. So now let's talk about, I want to talk about your process to getting this thing launched, right? Help us to appreciate kind of building it, funding it, scaling it. Talk us through what that's been like.
So it has been one of an interesting journey, to be honest. It's been, when you have an idea and you have a passion, one is passion, right? Because passion tells you that you cannot give up. And passion drives you to solve a problem. I know from a personal experience, there is a problem that exists. And then I double down and research that problem by traveling to international countries as well. and then say, how can we support those NGOs internationally? So I doubled down, went to 3 countries, the Caribbean countries, and then Rwanda as well, right? So really figure out whether it's a true problem. So we validated through that, and then went to DC and launched it. So the process of going through and launching it involves building a team. I met a friend of mine who's our CTO, Love Mochurombo, and then we hired a couple of back-end guys as well to help build the rest of the technology. So when you're building a tech, it's literally it's team mentality. Really being a servant. I believe in being a servant leader. So servant leader meaning that it is your team that really you're there to serve your team, and then ultimately serve your customers, right? Which means that you're there for making a change, making an impact. So I am an impact entrepreneur. So I really want to solve this maternal mortality rates for all Black women and Latinx women. Can this platform be utilized then for other ethnic background? Yes, it can be. I know we had a conversation even at InovCares system in Virginia, where they wanted to make an investment on the platform itself. So it's been an interesting. So long story short is we bootstrap this, right? Instead of taking outside investments, we bootstrap it. And now we're part of some key accelerators to actually gain more traction, right? So we're with an accelerator called EY, Ernst & Young.
Okay, great.
That's where I started my career. So we got into an accelerator program there, and then a few other accelerator programs as well to really get into those networks. And we utilize our advisory board members to be able to actually gain a more patient panel and get those warm introductions.
Huge. Congrats to you. So we've got probably about 5 or 6 minutes remaining. And really from here, I'd like to talk about the work that you're doing to empower other Black entrepreneurs, right? How are you helping Black tech, Black founders generally with accessing the capital that they need, building the solutions that they're looking to build, et cetera?
Sure. So I honestly have this, that if you have figured out a solution, at least in building yourself up and building a tech, it's also important for you to be able to go back and impact others, right? So I support Black founders through Good Nation and RCIE. So Good Nation, the entire notion of Good Nation is to fill in the gap that happens with relationship to connect Black founders to the right capital, and as well as the right relationships to gain access to more customers. So we're filling that gap, because oftentimes that's the gap that exists, that really goes down to that less than 1% of capital that's imputed into Black founders. Yeah. We can bridge that gap. That's a goal for RCIE. They support 100 Black founders, and most of these Black founders have physical products like chips, and actually Stephanie Chips, this gentleman here, Stephanie Chips, he's in Walmart and Target, right?
Okay.
And it was because of the relationship of the CEO, Jay.
Was that Deshauna Spencer on there?
Huh?
Was that Deshauna Spencer on there with Quelly TV?
So she's not. She's not part of that. She's not. But however, I actually know her. Okay. I host a podcast, so I brought her on our podcast.
Okay, awesome.
Deshauna is amazing.
She really is. Yeah.
They're a group of talented Black founders here in Atlanta that RCIE supports through their Paysetter program. So it's RCIE is part an incubator program, but as well as a co-working and as well as an accelerator. So it's like 3 functionality all combined.
It sounds just like B-Force that we're building.
They've got a beautiful building down here in East Atlanta.
Awesome.
And it's through that building. So we're trying to close the gap to ensure that these businesses, Black founders, have the resources that they need to scale.
So are we. So are we. Very cool. Oh man, I'm so excited. Okay, so how can folks connect with you? Definitely highlight the InovCares platform. I don't know if that's the most direct way to kind of access what you're doing there, but if it is, definitely highlight that, your podcast, anything else that you're doing.
Yeah, so folks can connect with me. You can contact us at InovCares.com. That's directly to my email. Of course, my CTO, his email is lchiwombo@InovCares.com. The number on there, it's actually my direct cell number as well, so you can definitely reach me. Our apps are on iOS and Android. InovCares, there's InovCares patient app, and there's an InovCares provider app. But I also do a podcast where we launched that last year. We did about 30 episodes where I talk to different healthcare providers and health technologists and entrepreneurs as well, addressing areas in their mental health, their physical health, really looking at the 8 dimension of wellness and how to empower others to adopt that 8 dimension of wellness, meaning your physical health, your spiritual health, and really your financial health as well, right? Looking at it from a holistic point of view. So you can reach me there too. And through our journey, I wrote a book called The Empowered Patient book, The Empowered Patient. So on the podcast itself, that's the book cover, but we haven't released the book yet. But it's really telling the stories of our patients' experience.
Empowered patient.
Yeah.
I love it. Okay, wonderful. Yeah, I didn't mean to cut you off. I got excited when you.
You're fine. So it's the empowered patient is literally telling the relationship between patients and provider, and really returning to the old type of medicine where insurance people are not usually the driver of better health. It's about the patients being healthy and well, and we as in InovCares, we're connecting all the dots for them, and then them living their best life, but then having resources. Healthcare providers are culturally competent to be able to empower them. So it's really just bridging the gap between the patient and the provider.
That's awesome. Mohamed, I want to thank you so much for coming onto our show today. This has been fantastic. Congrats to you on all the work that you're doing and really making a difference in terms of mortality in our community. So thanks again, and certainly look forward to having you back on as things progress and you're able to grow the company.
Awesome. Thanks for having me, Blair.
For sure.
Thanks for having me, Blair.
This show is brought to you by Positive Vibes Incorporated, our consulting services. We do credit fixes, tax resolution, we lend private money to real estate investors, and we do debt consolidations. Basically, we put money in your pocket when you need money. We put money in your pocket when you need money. 757-932-0177.
Phenomenal. Stay with us online at Black Wall Street Today on Facebook and Black Wall Street Today on Instagram, and then follow us on Twitter as well at BWS Today. We look forward to talking again next week. Have a wonderful week. I have said, and I will continue to say, that the most important priority for the Black community is the Black community, not a particular political party. Phenomenal.
Hey, yo, when I say Black, you say Wall Street. Black Wall Street. When I say Black, you say Wall Street. Black. When I say Black, you say Wall Street. Black. When I say Black, you say Wall Street. Black. Black Wall Street. Black Wall Street.
Phenomenal.